Radiocarpal joint, palmar and dorsal glide, radial and ulnar glides, as well as you can do a gentle distraction as well. Radiocarpal distraction, anterior posterior. Find the end of the radius first. One of the most common things I see happen when people are first trying to mess with the wrist is they're actually up in the metacarpals, not down in the carpals. See, kind of if you extend your wrist back, that bottom line should be about where the end of your radius. A distraction, and basically you're trying to grab a hold of the scaphoid triquetrum over there. Sorry, a little bit of gentle distraction. Resting position is slight flexion for the wrist. So I've got essentially the proximal row in my fingers, palpate right off the end of the radius, slight distraction there. Same thing we did before. Whether you're using the wedge or the end of the table, for this one's not as big of a deal. Just make sure you're stabilizing the radius and the ulna. Grab the proximal row of carpals with your hand. You can do this one so in kind of the resting position, which we talked about, everything's slight flexion for resting. So if I'm just kind of doing like an oscillation for pain relief, I can be here. If I'm trying to work on improving movement, either with a flexion limitation or extension limitation, I can go to that point and do some distraction from there as well. So you can do it anywhere in the range for distraction. Yeah. The palmar glide. So what's my direction going to be for the palmar glide? Scaphoid, lunate here with my finger, kind of pinching them. Palmar and slightly proximal. There you go. Palmar glide. I'm going palmar and just slide. That's not a lot. Come in and pinch over the scaphoid and the lunate, anterior and proximal. Because the end of the radius. So having the distal end of the radius right on the edge of the wedge, and I often like to do this anyway, is just bring my finger right under so my finger's under the distal end of the radius, so I know exactly where that is. I'm going to use your MCP right over the scaphoid and lunate. So if I'm doing a radiocarpal palmar glide, that's typically for what motion of the wrist? Extension, good. So we may bring the wrist into the palmar glide from there. Your hands should be really close together for that, right? You can pull up into a dorsal and distal glide, or you can flip them over and keep them in slight flexion. Sorry, I let the hand drop. So I still keep them in slight flexion, dorsal, and a little bit distal. Everything's going to be the same, but now I'm doing for flexion. So I'm going to bring the wrist up into flexion, MCP over the scaphoid, bring up into flexion, get in line. As the distal end of the radius has that hook on the end of it, I'm kind of going in a dorsal and distal direction with that. Have the hand right over the top. I want to essentially bring my MCP right over the scaphoid here. I'm just going to do an ulnar glide down with the wrist. Radial glide coming up. The ulna, use your finger at the edge of the wedge. MCP over the scaphoid, glide in an ulnar direction. It's for radial deviation, right? So, and come up to the point of restriction for radial deviation, ulnar glide. And then for a radial glide, if you're doing oscillations, fine. You can be here and do pull up for some oscillatory motions. But if you're going to do a mobilization for ulnar deviation, so I can bring them up into ulnar deviation, blocking the end of the radius, MCP over the triquetrum, and glide. You remember you have that radial styloid process there, so you may have to get a little bit of a distal glide for that as well. And then you can use the wedge to kind of block that proximal row. And then this one you are going to use, you can still use a chopstick grip here. And you're going to do a palmar or a dorsal glide. So a palmar glide would be more for what movement? Glide or flexion, good. So the end of the radius, the first bone off is the scaphoid. We know the scaphoid also pokes up into your finger when you go into ulnar deviation. Find the trapezium and trapezoid. Oh, yep, there it is. Great. And keep that scaphoid pinched underneath my finger. Trapezoid and trapezium in my hand. Ulnar glide and dorsal glide. And then for the intermediate column, so we're going to move the capitate on the lunate. Find that scaphoid again. In the middle is the lunate. You can find for sure that you're on the lunate by looking for movement between the scaphoid and the lunate. I'm going to block underneath the lunate. Now this one I would use the caliper grip on because it's a much smaller bone. On the palm side of the hand, make sure you're squeezing deep enough to really hold onto the bone. Palmar and a dorsal glide. So with our capitate, the extension would be which glide? Ulnar glide, the capitate, flexion, dorsal glide, the capitate. Those are the only two we're really going to look at from the intercarpal standpoint. The capitate on the lunate and the trapezium and trapezoid on the scaphoid are really our main two areas for looking at the extension and flexion at the intercarpal joints. So for the lateral columns, what are our two bones that we're addressing? So we're moving the two T's, the trapezium and then the trapezoid on the scaphoid. I'm going to take my MCP, put it right over the trapezium and trapezoid. Use your finger as the base for the scaphoid. So now you know I've got the scaphoid locked in place, and I'm locking that down on the wedge, so I have a good solid base. Palmar glide of the trapezium and trapezoid on the scaphoid. That would be for which motion at the wrist? Flexion. Yeah. Trapezium and trapezoid are concave on a convex scaphoid. So I'm going to do a palmar glide for flexion. For extension, you're just going to rotate over, do the exact same thing. You're just going to come to the other side of the wrist, block, take into extension, and do your glide from there. Find the lunate by slightly extending the wrist. Find that little gap so you can feel the distal end of the radius. And then there's a bone that's poking up against your thumb that's kind of sticking out. That little poking up piece is the capitate. The lunate is underneath your thumb. Pinch the lunate. I've got that stabilized, and I can be on the capitate with my MCP. A palmar glide of the capitate. Extension, good. So I might bring him into a little bit of extension here, bring him up to the point of I'm in a much better position to be able to do this. Dorsal glide, same thing. You can come in if you want and do pinch the capitate. And so what we're going to look at, if I'm looking at flexion and extension, I'm going to have the back of his hand towards me, right? Because I'm doing an ulnar and a radial motion, palmar and a dorsal glide. I'm going to put the palm down towards the floor so that my palmar glide is towards the floor and the dorsal glide is towards the ceiling. Right, so here and here. So we'll look at flexion extension first. So for flexion, which way would my glide be for flexion?
Ulnar.
Good. To block the trapezius and the trapezium and the trapezoid, pinch the distal end of the metacarpal, a palmar glide for flexion, or a dorsal glide for extension. You can also kind of come up underneath if you want and hook your finger underneath the metacarpal and your thumb on top. So now like I've kind of got a grip on it like this, right? So I've really got a good control of it. Palmar and dorsal glide. Make sure though that you're doing a glide and you're not flexing and extending with it in an ulnar direction and in a radial direction. And the palm down towards the ground. Keep my trapezium and trapezoid here. You're going to take your thumb for this one and kind of go right into the web space there. Palmar glide. And a palmar glide now would be for dorsal direction, right? So it's moving towards the back of the hand. And so a palmar glide, adduction. Dorsal glide for abduction, because even though it's moving away from my hand, towards the palmar direction. Same positioning here. Stabilize, palmar glide, dorsal glide. In the thumb, they're all the same. What's the relationship? Concave on convex, yep. So that's going to be our MCP joints, PIP joints, and our DIP joints. And that's the resting position in the hand at all the joints is a slight flexed position. That's what you want the hand in when you're assessing. Ulnar Glide, Dorsal Glide. Same thing all the way down. You can also do Ulnar Glide and a Radial Glide for each of the fingers, for each of the joints in the fingers as well. At the MCP joints, we do have a lot of varus valgus movements or abduction, adduction movements going on, and so that's definitely important. You can also distract each of them, so holding there, just kind of get a sense of the overall mobility. Why would you care about that? What's that? Necrosis. Okay. Yeah, it would definitely hurt. And what, like, patient have their hand above their heart. You want to be able to see the palm of their hand. You're going to take your thumbs, include the ulnar and radial artery, and then have them pump their hand like this, so they're essentially pumping all the blood out of their hand. Good. And then you have them open their hand, so open your hand wide and let go of just one of the arteries. And what you want to see is a return of redness, so it should be blanched. You want to see the refill come in from the radial side. Similar, so if I do the ulnar artery, it should come from the really red. Just have her do it some more. Yeah, limited flexion of the PIP joint. There's two things that can limit that. One being at the joint itself, so a capsular restriction, and the other would be tightness in the extensor tendons. I extend my MCP joint. What have I done to the extensor tendons? Put it on slack. If I can now flex the finger, what was the problem? Muscle. If now I can't, I still can't get any more range, what was the problem? Capsule. Give it to Matt to hold. So normally, if he's going to like hold on this piece of paper, I'm going to pull this out. His thumb stays straight, right? Because he's using the adductor pollicis to hold that in place. If his thumb comes up into this position, then he's using the flexor pollicis longus to keep that grip instead of the adductor pollicis. The profundus is affected. You can't flex the flexor digitorum profundus.